Hi. This may really be crappy timing on my part to be talking about this and this just a few days before Christmas, but it's important. So what is this 5-pound mass of adipose tissue, also regarded in medicine as fatty tissue, have to do with this diagram of the heart? And what has that got to do with this stethoscope, which is used to listen to the heart? Well, recently there's been a lot of news, and I think we need to talk about it. I just went and checked, and this is indeed 5 pounds precisely of fatty tissue. Now, fatty tissue in the human body has numerous functions. One is to help regulate glucose or sugar, energy, because we can tap into this. Another is in cholesterol formation. I think there's a quote I have right here. It is, adipose tissue in humans is a major site for cholesterol storage. In obesity, over half of total body cholesterol may reside within adipose tissue, like this. However, relatively little attention has been directed toward understanding the cholesterol metabolism and its relationship to whole body cholesterol homeostasis in this tissue. That's why we're talking about 5 pounds of fatty tissue. We're talking about the heart because this is how we get attention given to oftentimes fatty tissue, glucose, and cholesterol. And this is a stethoscope that in some problems with heart disease, this will give us a tip-off, but not when this is in play. I can't hear any fatty tissue abnormalities, too much, too little. I can't hear cholesterol through that. That's why we call so often certain heart diseases as silent diseases, where the patient gets no specific symptoms. And I detect no specific abnormalities by doing a physical exam. Everything seems to be A-OK, copacetic. Bottom line is, if you look at these vessels in the heart, you see the heart and supplies the brain. But anyway, these vessels presumably get clogged because of cholesterol. So let's turn to the recent news. First off, let's start with Daily Wire by Corinne Murdoch, December 15th, 2023, just within the last week. Hot off the press. What does it say? Ivy League doctors, obesity is the new normal. So I'm just going to highlight the article. Ivy League doctors say that obesity constitutes a new normal for Americans, classifying it as a chronic disease that requires perpetual drug intervention. In a 6-part series on Medscape, quote, treating obesity, confronting a new normal, end quote, doctors from Harvard, Yale, and Rutgers medical schools made the case that obesity doesn't stem from behavioral issues. In the latest episode, the doctors touted drugs as the cure to obesity. They discussed the injectable appetite suppressant semaglutide. That's the weight loss drug popularized by celebrities under the name Ozempic or Wegovy. Dr. Jastroboff says, I think we're in an incredibly exciting time. Now we have highly effective and safe medications that target disease pathophysiology. The doctor said that individuals have to take the drugs in perpetuity. That means without any endpoint in sight. Dr. Jastroboff says, I have lost the weight. Can I stop taking the medicine? This comes from a patient. Dr. Jastroboff says, the answer is no. You have to keep taking the medicine. Dr. Chika Anekwe, an obesity medicine doctor with the Massachusetts General Hospital Weight Center, concurred. Quote, once you started a medication, we expect that you would stay on it long term. Now, the article closes with this statistic. The American Medical Association recognized obesity as a chronic health condition in 2013. Over 40% of American adults and 20% of children qualify as obese. So remember, if you're carrying around 5 pounds of extra fatty or adipose tissue, that's what it can look like. All right. I have said for decades that obesity is a multifactorial problem. It has absolutely profound roots in the genetics we inherit from mom and dad, that random shake of the dice when the sperm and the egg come together, oftentimes predestine us towards certain kind of body habitus. People have complimented me at times saying, gee, Dr. Jensen, you stay so slender and fit. No, I don't really deserve a compliment there because I'm not very careful about my diet. Many people who indeed are overweight are far more attentive to what they eat, how much they eat, and trying to work out and burn off those calories. I happen to get a favorable genetic shake of the dice. I burn calories a little bit more easily than someone who might, right alongside of me, be similar age, similar level of activity, similar level of caloric ingestion, and they might have a huge problem with overweight, and I don't. I've said for a long time, genetics are a huge issue. But then I think the environment in which we grew up, that's an issue as well. And then I think our own decision making, that's a big issue as well. Are we eating this kind of food or that kind of food? Is this our snack or that kind of snack? And then I think we have to ask, what kinds of foods are being put in front of us? What kinds of processed foods? Last week, I had a very good conversation with a patient about fructose and corn syrup. These things matter. But the bottom line is, I think we have to be sensible about this. And that means we need to understand that this is multifactorial. We do not need to be shaming people. That's absolutely the wrong approach. But on the other hand, I think the notion of saying obesity is a new normal, anybody that's obese, get on a medication and plan on it, being on it for a long, long time to come. Okay, so I got a little beef with that approach, especially if we're talking about treating kids with drugs, particularly injectable drugs, particularly if we're going to say this has to go on for a long, long time. I think that this is a multifactorial problem, and I think the solution will also have multiple components. It has to be about our food choices. It has to be about how our nation creates food and how honest it is. And can you see the foods? We need to start teaching people how to read food labels to understand how many calories are in there, how many fat grams are in there. Are you eating mostly carbohydrates, fats, or proteins? I tell patients all the time, the typical American diet gets the great majority of its calories from carbohydrates and far less from protein. If we can flip that so that protein-sourced calories are up here and carbohydrate-based calories are down here, we would do better. That's why you see a lot of, if you will, low-carb diets. You see the South Beach diet. You see the Atkins diet. You see the Mediterranean diet. You see lots of different kinds of diets. But the bottom line is we can impact on it, even if we did not get a favorable genetic shake of the dice. But we can also work incredibly diligently on trying to do all the right things in terms of making choices, exercising, monitoring our calories, and still not really feel like we're winning the battle against obesity. There should be no room in this for shame. People try hard. We should compliment their efforts, and we should work together to do it as well as we can. But the idea of saying that it's a new normal and everybody needs to be on long-term medication, even injectables, is problematic for me. And that's why I want to put this in front of you. Okay, let's move to the next article. This was by Vinay Prasad, a physician, and he had an article called "For Obese Kids, the United States Preventive Services Task Force Recommends Diet and Exercise. The American Academy of Pediatrics recommends surgery and Ozempic." And this is his article. I'm just going to read parts of it. He talks about the United States Preventive Services Task Force. It's an independent panel of experts. He talks about the American Academy of Pediatrics. It's an American Academy of Pediatricians, and they put out their own perspectives on issues. And this is what Dr. Prasad says. Dr. Prasad says, the American Academy of Pediatrics proudly told parents to avoid peanuts in kids at high risk of allergy. That turned out to be exactly the wrong advice. It increased allergies. He went on to say, the American Academy of Pediatrics are happy to offer strong opinions when the best course of action is to collect data. Then he goes on to say, he identifies this article as CNN Health. Headline, CNN, slightly left-leaning news source potentially. Doctors should intervene to help children with obesity, task force draft says, but it doesn't recommend surgery or meds. In other words, the United States Preventive Services Task Force says we should work to help with kids. We should intervene, but it shouldn't be surgery or meds. The task force examined studies, including the weight loss drugs that are out there, but there wasn't enough evidence to determine what effects they could have in the long term. And for that reason, the task force called for more data. Now, that's not what the American Academy of Pediatrics did. They said in January, for kids as young as 8 years old, use of pharmacotherapy, drugs. It says they recommend that pediatricians offer children 8 through 11 obesity, weight loss, pharmaceuticals, or drugs. May offer between 8 and 11. But if you're 12 and over, the American Academy of Pediatrics recommendation says that you should offer adolescents, 12 years and older, weight loss pharmacotherapy. Not may, should. So if you're 12 and over, maybe not even into puberty much at all, we're hearing that we should be offering long-lasting, high-powered weight loss drugs. Dr. Prasad says, to recommend a costly drug with an uncertain long-term safety profile to 12-year-old children based on current evidence is incredibly unwise. It feels as if the American Academy of Pediatrics is working for the pharmaceutical firms, not children. He goes on to say, the United States Preventive Services Task Force reaches the only sensible conclusion. For now, more data is needed. So here we are, we're at a crossroads. We're getting a lot of media sources going on. Dr. Prasad closes his article by quoting from the American Academy of Pediatrics. From their document, this is what he says, that they said. Use words that are perceived as neutral by parents, adolescents, and children. Preferred words include unhealthy weight. Words perceived as most offensive include obese, morbidly obese, large, overweight. Those are words you're not supposed to use. And Dr. Prasad grieves the fact that terminology in medicine such as overweight, BMIs, things like that are offensive, but we can say unhealthy weight. He says, this is Orwellian, or in the spirit of George Orwell's novel, 1984. Why am I talking about that today? Because the whole matter oftentimes revolves around the heart. And if we're going to talk about how we're going to deal with this and how it impacts on the heart, then let's talk about what we've told you in the past. Let's go right to the heart of something that has been literally ingrained into the world of medicine. And if you dared to push back, if you dared to question the experts, you were oftentimes branded as an unreliable maverick. You might have been branded as a reckless speaker to the issues of health. You might have even gotten yourself in trouble with some sort of licensing board. I might know a little bit about that. So let's turn to 2009, just about 15 years ago. Article, CNN says, heart failure may worsen with statins. Okay, did you hear that? Heart failure may worsen with statins. You know the statins, the Lipitors, the Crestors, the Zocors. Ann Harding writes this article November 5th, 2009, 14 to 15 years ago. First sentences of the article. It's widely known that cholesterol-lowering statins can benefit patients with heart disease, but a new study suggests that may actually harm some people with heart failure. Heart failure can occur when arteries become clogged, but in heart failure, the heart gets progressively weaker and larger. This article talks about the fact that with statins, heart failure may get worse. Then we go to another article. 10 years later, this is in a journal called, I don't see the title of the journal. Oh, it comes out of public chemistry compounds. And it's written by Peter Langsgen, Jen Langsgen, Helena Langsgen, Franklin Rosenvelt, and it was called Statin-Associated Cardiomyopathy Responds to Statin Withdrawal and Administration of Coenzyme Q. Okay, what are they saying? That means cardiomyopathy that's associated with statin drugs can respond and potentially heal if we stop the statin drug and administer coenzyme Q or CoQ. You've heard of that, an antioxidant that can be helpful. So that was 10 years after this other article reported by CNN. And the conclusion of this article was this: statin-associated cardiomyopathy may develop that responds safely to statin treatment discontinuation and CoQ supplementation. Statin-associated cardiomyopathy may be a contributing factor to the current increasing prevalence of heart failure. Then we go, just do a Google search. I put this in the Google box. Do statins cause heart failure? This is what it says. This is from the National Institute of Health. It has been hypothesized that despite the positive effects reported, high doses of statins in patients with long-term heart failure lead to progress in heart failure by inhibiting CoQ10 synthesis and intensifying hypertrophy. The next article says, statin-associated cardiomyopathy, another article by the National Institute of Health. The next article that comes up, CNN, heart failure may worsen with statin, study says. Mayo Clinic, statin side effects, weigh the benefits and the risks. European Society of Cardiology, the fatal dangers of statin misinformation. And then recently, in the last week or so, an article in Epoch Times, long-term use of statins linked to heart disease. Now this was in an article in a journal called Clinical Pharmacology, reasonably respected, well-distributed journal, Clinical Pharmacology. Here's what it says. Vance Vogtberg wrote the article, 12/15/23, in Epoch Health. For decades, statins have been heralded as the reliable heroes in the battle against heart disease. However, this seemingly flawless reputation has been called into question. Okay, so is it okay if I call it into question? I would submit that if I and your physician and other physicians don't call this reputation into question, when we're seeing as much come out as we're seeing now, do statins cause harm? We know that statins increase blood sugar. We know that statins can cause diabetes. Now we're being told that if you want to get rid of 5 pounds of adipose tissue, long-term medication therapy in kids 12 and up is a should, not a may. Okay, let's continue. The review, this article I'm referencing, published in Clinical Pharmacology, suggests statins may act as mitochondrial toxins, impairing muscle function in the heart and blood vessels by depleting CoQ10, an antioxidant cells used for growth and maintenance. Multiple studies show statins inhibit CoQ10 synthesis. That's a problem. Antioxidants, many people recognize the potential value of them. According to the authors of the study, quote, we believe that many years of statin drug therapy result in the gradual accumulation of mitochondrial DNA damage, end quote. Study goes on to say this. Statins impair the production of vitamin K, an essential vitamin in managing calcification. Have you heard about the CAT scan scores, the CAT scan calcium scores? Go get a CAT scan of your heart, get a calcium score. Some people speak of those scores with certainty and assurance, while others are perhaps a bit more nuanced, recognizing that the jury is still out in terms of what a calcium score actually means, because a calcium score doesn't linearly cross over into a specific reliable prediction of atherosclerosis or plaque building up in the coronary arteries that would limit the flow. We don't have that information yet. We're still looking. There's correlation, but in terms of causation, it's problematic. In this article, they go on to talk about a 2021 study found a connection between statin use, coronary artery calcification, and vitamin K2 deficiency. In other words, they're saying statin use correlated with increased coronary artery calcification. So in other words, you're increasing your calcium score by potentially being on statin use, and you're also potentially incurring a K2 vitamin deficiency. The article goes on to say, based on emerging evidence on statins' potential cardiac downsides, the authors of the new review warn that physicians in general are not aware that statins can cause heart failure and are clearly not recognizing it. And I would submit that that's true. I think that an awful lot of patients are put on a statin drug, and they are not told that it can increase their sugar, potentially push them over the tipping point into the realm of being diagnosed with diabetes, nor do I think patients are being told that it's possible that statins literally may increase your risk of heart failure or the severity of your heart failure. This article goes on to say, with over 1 million annual heart failure hospitalizations in the United States, the condition is often referred to as an epidemic, and it may be that statin drug therapy is a major contributing factor, according to the review. So, do I have the privilege? Do I have the right to speak to what I see happening literally over the last few months? I mean, it doesn't take a rocket scientist or someone who reads a lot of newspapers to recognize that we're hearing so much about the GLP-1 drugs, the Ozempics, and the variety of injectable once-a-week weight loss agents. And yet, now we're seeing that statin drugs are being called on the carpet, that they may actually aggravate heart disease in some situations, while statin drugs have enjoyed the reputation as being virtually heroic in reducing heart disease. So I'm going to leave you with this. If doctors aren't willing to challenge the experts, if we're not willing to share with you what statin drugs can do to your glucose, that statin drugs might have an impact on a cardiomyopathy picture, on a heart failure picture, are you getting informed consent? And are doctors potentially allowing patients to think that with a stethoscope, we're evaluating that kind of thing? Because we're not. With this stethoscope, I can hear valuable information about the function of your valves, the regularity and pace of your rhythm. Occasionally, I can hear a sound that might indicate a heart failure problem, such as an S3. But for the most part, my stethoscope does not give me the information that I would need to determine whether or not a long-term anti-obesity injection every week is doing the job in regards to your heart risk. Nor am I able to determine what's happening to your body and your metabolism regarding glucose and what the statin drug might be doing to it. You see, I'm of the mind that if I don't confront the experts, I'm not standing by your side. I think I'm betraying your confidence, and I'm not providing you informed consent. And I would say one last thing. Why is it that it seems like so many of these conversations always come back to Big Pharma? Why is it that we're talking about an every week injection for 12-year-old kids on a long-term basis that's going to be potentially $5,000 to $20,000 a year? Or we could talk about the latest and greatest statin drug, which, frankly, drug companies have made billions of dollars over the last 20 years. It seems like all the fixes we're putting on the plate, all the fixes we're telling you about are drugs, medications. And it's not as if we're telling you about the downside of them. So you heard it here. Statin drugs, we should be concerned what they do to your glucose level, and we should be concerned whether or not they could be increasing your calcium score, the calcification in your vessels, and we should be concerned if they could potentially be causing some sort of cardiomyopathic sequence of events that would cause you to be at greater risk of either heart failure or your heart failure worsening. The experts need to be confronted.